Good afternoon, everyone. I'm starting my case conference of patient who is a 28-year-old female. She studied till MA. She's a homemaker, lives in a neutral family, and lives in an urban background and belonging to lower socioeconomic status. Uh, she has an identification mark being black mole of 0.5 millimeter, 3 centimeter below the zygomatic evidence on the left cheek. She lives in Dehradun, and the source of information is given by father, husband, and the patient herself. The informants are Roshan, he's his 60-year-old male father, studied till class 10th, works as an operator in a private company, and a husband, 32-year male, studied till class 12th, works in a private company, stayed with the patient throughout the illness. The chief complaints are low mood, decreased social interaction, fatigability, and ideas and suicidal attempts for past 1 month. The complaints are insidious in onset, episodic and iterating course, and the history given is clear, coherent, given in a chronological order, congruent, and reliable and adequate. Precipitating factors being husband being diagnosed with both kidney failure and requiring renal transplant. Patient was apparently well 3 months back when she was carrying out her normal routine activities and was taking care of her children and husband. She would frequently visit her parents and would spend time with them. She would even help her mother in household work and would take care of their health by keeping a check on them. It was then when her husband started reporting health issues for which he was evaluated and diagnosed with kidney failure requiring kidney transplant. He was started on dialysis treatment, and his wife and parents started searching for a donor. She started to stay, after which she started to stay alone and would appear lost in her thoughts whenever her husband would look at her and would talk to her. She would travel with her husband for dialysis and treatments and to Chandigarh for the investigation and would take care of him as before. Gradually, husband started noticing that she would not interact with him as she used to and started keeping things to herself. Her visits to home were less than before and would less frequently call her parents regarding their health. Whenever her parents would call, she would try to avoid their calls or would make an excuse regarding her preoccupation with the husband course. She would wake up in the morning and would lay in bed for 1 to 2 hours and would find it difficult to get out of the bed and work. But as reported by the patient, she used to force herself to start her day. She would forget about her children homework and would not be able to teach them or take interest in their daily activities, which she used to do earlier. Noticing this difficulty, her husband decided to move with her parents for proper care of children and to manage regular hospital visits. It was in June that, after multiple tests, she was chosen as a candidate for the renal transplant, which she herself gave an idea to carry on with. She was relieved that her husband would be fine and would be at the same time reported by the father had second thoughts regarding her decision and said to her father, क्या होगा मैंने किडनी दे दी तो मैं मर जाऊंगी. And when father would console her that even they can consider donating their kidney, then she would say नहीं मैं ही दूंगी और कौन देगा उनके बिना मैं क्या करूंगी. When she was with her parents, she would be seen sitting alone in her room and would ask her mother to take care of the children. As kids were on the summer break, she would wake up late than her usual routine and would not be concerned about her daily routine activities. She would eat meals timely but would be seen laying in bed the whole day or would be engaged in a mobile phone most of the time. When her mother would ask her to look after the children, she would instead ask her father to look after her children, as she would not feel the energy to get out of the bed and would even refuse her mother when she would ask her for any help that was contrary to her previous behavior. As reported by the patient, she would get thoughts that मैं जीके क्या करूँगी, but at the same time would think of her children and that who will take care of them if she would do harm to herself. She started talking about dying a peaceful death with her father and said मैं फांसी और जहर लेके नहीं मर सकती. To this, the father got scared and asked her mother and husband and even children to stay close to her and never leave her alone. But she decided to move away when someone would be around and would be seen with cuts by a sharp object on her wrist, which would be superficial, precise, and would not require any immediate medical attention. When her father would ask her why did she do that, she would say, "पता नहीं मन करता है ऐसा करने का." Then her family members started hiding sharp objects so that they would be out of her reach and would be irritable when she would not get nothing. She would get nothing to cut herself. One day, her mother noticed that she had a large quantity of open medications by her side of the bed and was seen consuming 3 to 4 tablets daily without any prescription or supervision. After seeing this, her father removed all the medications and scolded her, in response to which she started shouting, saying, "मुझे दवाई दे दो, वरना पुलिस को बुला के बोलूंगी मुझे मारना चाहते हो." Her father would not listen to her, but she would get aggressive to the extent wherein she would again cut her wrist after going away from everyone. She would feel guilty after committing the act and would even ask for forgiveness from the father after a while. She would say, "गुस्से में हो जाता है, पता नहीं कैसे." After realizing her behavior, she started asking her father to take him to the doctor, mental health care professional, from whom he was on continuous medications. When her father would not find time for her, she would go for visits alone and started arriving to emergency department alone with the neighbor. She would inflict injury on her body. At one instance, while she was at home and was moving towards the washroom, a blade fell on the floor from her salwar of the suit. Her 5-year-old kid saw the blade and immediately shouted, rushing to hide it from her. But she got hold of it first and made a linear cut on the center of the neck, which was superficial. Seeing this, her parents got scared and planned to admit her. She herself would repeatedly ask for admission after that and would say, "मुझे ठीक नहीं लग रहा है, मुझे admit करा दो." The negative history. There is no history of crime spell, ideas of guilt, uh, decreased appetite, no history of persistent over cheerfulness, over familiarity, increased goal directed activity, or decreased need for sleep in this episode. There is no history of suspiciousness, fearfulness, self muttering, hearing voices not heard by others, no history of own thoughts being known to others, no history of disorganized behavior, no history of significant head injury, no history of any illicit substance intake. The past treatment history. Patient was started on tablet lithium from 2019 and still continued. The maximum dose reached was 900 and she was maintaining well on dose 725 milligrams. Response was good and she's still on the treatment. She was started on tablet pitayapin from 2020 and still continued. Maximum dose reached was 400 milligram and the response was good. So afterwards, she was also starting escitalopram and clonazepam combination from 2019 to 2022. The maximum dose reached was 20 milligrams of escitalopram and 0.5 milligrams of clonazepam. The response was good. She was also started from on paroxetine from 2020 for a few months. The maximum dose reached was 25, but it was changed because of she had a manic episode on the treatment. Past history. So first episode was 10 years back when patient was 18 years of age. Her parents started noticing changes in her behavior and would stay alone without interaction with her friends and family members. Her father started seeing a cut on her wrist at first. She would make excuses that it was accidental, but subsequently her father saw that she would go away from them in a quiet place and would make a cut with a sharp object. She was irritable more than usual self, and when her mother would coax her about anything like eating food, she would throw the food by hitting the plate in anger. After which she would rush and hide in a place in order to avoid any scolding by the parents, but would have realization of her behavior. One day, while being in her mother's room and no one was around her, she ate all the sindoor, after which she was not able to speak for the day. Next day in the morning, she told her mother she has to visit a shop nearby and went alone. When she didn't return home, her father asked about the neighborhood. When she didn't return home, her father asked about her in the neighborhood, and he got to know that she didn't visit the shop but instead was seen heading towards the jungle. Her father followed her to the jungle, and after getting a hold of her, when he asked why did she get there, she said, "मुझे नहीं पता मैं यहाँ कैसे आई." After this incident, his father took her to the faith healing and was improved in 10 to 15 days. In 2019, patients started having episodes wherein she would fall on the floor with one hand shaking and twisting, eyes closed with no history of tongue bite, urinary incontinence, or falling from the mouth, occurring for 3 to 5 minutes, and would wake up after attendants would sprinkle water on her with no confusion thereafter. Patient would not remember the episode and would always occur when someone would be around her to hold her. Episodes would sometimes occur 3 times in a day for 3 to 4 subsequent days and sometimes one episode in 15 days. Patient consulted a neurologist and was started on anti-epileptic, after which there was increased sedation, swelling of face, peeling of the skin as reported by the patient and attendant. Patient left medications after 3 to 4 months but started reporting of low mood, impulsive thoughts of self-harm. She would constantly report the thoughts of doing some harm to herself. While she was with her parents for festival, she sent her father and sister inside to get something and ran outside, locking the door from outside, and was seen standing on the terrace balcony, which was 14 feet from the ground. When her father saw her, he ran to get her but was unable to do so as door was locked from outside. Before he could reach her, she jumped off but kept her hand first when she fell, because of which she suffered trauma, severe injuries and fractures with no significant head injury. She was then started on medications and was given 3 MECTs with improvement in complaints. In 2021, attendants reported that she started to appear over-familiar to others, over-talkativeness was present, and she would continuously talk over phone, unlike she used to. She would work throughout the day and would wash clothes daily with her hand despite of having a washing machine. She started to buy clothes impulsively, spending large amount of money without any reason. She would have normal sleep and appetite and normal functioning of the day-to-day activities. This episode lasted for 1 to 2 months and was resolved on her own. So family history, she is second in order of 4 siblings. There is no history of suggestive of medical or family psychiatric illness. Uh, Patient lives in a nuclear family and has a cordial relationship with parents and siblings. Family is supportive towards the patient and understands the importance of regular follow-ups. The economic head of the family is father, the emotional head of the family is mother, and patient is closest to father. There is history of stillbirth of a first child, which was a female, after marriage. The personal history, birth history, patient was a normal vaginal delivery, birth weight is not known, no prenatal, antenatal, postnatal complications were reported, no history of delay in developmental milestones, no history of admission in NICU. Patient was breastfed for 6 months and weaning thereafter. No history of desertion by parent, no history of broken home, no history of hyperactivity, stealing, or bedwetting. Occupation, scholastic history, patient was an average student, started schooling at the age of 5. There is no history of any repetition of any class. In 10, she scored first division. In 12, she scored 12 second division. Occupational history, patient worked with his father for 2 years in his company and did graduation from distance learning. Personal history, some menstrual history, puberty. She achieved puberty at the age of 13, menarche at the age of 14 years, regular cycle of 30 days, 4 to 5 days bout of bleeding. The LMP of patient was 23rd June. Pre-morbid personality, she had a good social interpersonal relationship with family and friends and was caring towards them. Would easily make friends but never had a close long-term relationship with friends. Responsible towards his work and family, would make decisions after consulting her mother and would get easily irritable over trivial matters. Intellectual activity, she enjoyed listening to music and cooking. Mood was stable and could express inner feelings of anger, frustration, and sadness, gets angry over minor issues. She was religious by nature, attended puja and visited temple with family. She would abide by the law and respect the social norms. Habits had a regular sleep-wake cycle and rhythmic bowl and bladder habits. Impression, a well-adjusted personality. From physical examination, she's a mesomorphic built female with the height of 163 centimeter, weight of 70 kg, BMI of 26.4 kg per meter square. There were injury marks over the neck, cut marks, and multiple cuts on the right and left forearm and wrist were present. So BP pulse was normal. So on physical examination, gross weight was on MC, patient entered the room unaided, sat in the chair provided, greeted the interviewer, looked as per gestated age, hair tied in a bun, wearing a suit, and looked adequate as per the surroundings with adequate grooming and hygiene, maintaining adequate eye contact, in touch with the surroundings. The psychomotor activity was decreased, speech was decreased in productivity and tone, reaction time was increased, was clear, coherent, and goal directed. Mood ठीक है, affect was dysphoric, shallow, communicable, congruent, and appropriate. Thought flow was normal, no formal thought disorder. Content, there was ideas of hopelessness, pessimistic views about future, and repeated suicidal thoughts and impulsive acts was present. Possession, none, and conceptual abnormalities were reported. Cognitive functions, attention, she could do serial subtraction test when asked to 40 minus 3 test was done, but refused serial subtraction of 100 minus 7. Was able to count days of the week backwards, but was with difficulty. Memory, her immediate, recent, and remote was intact. Intelligence, she could tell the use of chlorophyll, function of the lungs, and CM of Uttarakhand. Abstraction could answer the proverbs, but could tell only one similarity between table and chair, but two similarity between apple and banana. Judgment, her personal judgment was impaired, social and test was intact. Inside being great. So she's kept on a provisional diagnosis for bipolar affective disorder, current episode severe depression without psychotic symptoms, with intentional self-harm by sharp objects. So I did the big suicidal risk assessment. So it was low intent and Hanvi score was also 14. Management may I would assess the patient for immediate safety of the patient. Maybe they are depressive episodes, but last year she had an episode of hypomania on the medication. Yes, she did. I said no, she was started on anti-epileptics, after which there were side effects. So she consulted a neurologist who gave her. No, she did not consult with someone. Husband कोई kidney failure, father She has contradictory things. One time she says does it impulsively, and one time she says that she doesn't want to live because of it she does. 14. 14. That's why I kept her on bipolar. That was a depressive episode with suicidal attempt. 14 feet. She said that she doesn't remember anything that happened that time. But the mood symptoms were present as she reported. She was on medication from 2019, and mania episode was in 2021 last year. It was a hypomania episode on medication. Because she's, I think, she has suicidal attempts, suicidal thoughts. She's saying that she does it impulsively, but sometimes she's saying that she has the thinking that she wants to die, and she does it because she wants to die.